I'm Dr. Sayeda Ruksheda. I'm a psychiatrist and I'm based here in Mumbai, India. We talk about mental health and mental illnesses far more naturally these days. No one's as happy about it as I am. Mental health is essential for our functioning and well being. We know that. We also know that psychiatric illnesses, mental illnesses like depression, anxiety, OCD, schizophrenia, eating disorders, substance dependence, and many more, they are medical disorders. They are genetic in nature. They are neurochemical in nature that changes the structure of our brain and the functioning of our brain. That impacts our thoughts, our emotions, our behavior, our cognition, and also has physical symptoms. When we understand that these are medical disorders, we also understand that timely treatment is very essential for recovery and for better outcomes. We also know that a combination of therapy and medication guarantees a better outcome than just one alone. There is a lot of misinformation and myths about psychiatric medications, and a lot of people hesitate to take them. I know I still get a lot of patients who come and tell me things like, I know I have depression or I know I have anxiety, but I don't want you to treat me with medications. Other people will come and say things like, bhari dose nahi dena. Some people will have apprehensions saying that once you start taking medications, you're always going to have to take them. Other people have concerns that these are addictive medications. Some also wonder that maybe these are life changing because they are brain changing and brain altering medications. Some are very scared that these have bad psychiatric side effects and also physical side effects like obesity and metabolic disorders. Let's try and figure these out. Just like there are a lot of different psychiatric illnesses, there are also a lot of different psychiatric medications, depending on what kind of illness you have and at what level, mild, moderate, severe, whether it's of short standing or whether it has been a chronic illness that has only either been diagnosed now or you've just had the courage to take help now. Depending on those, a treatment plan will be made. And the treatment with medications is going to be planned according to your requirements, how it may help you function better and also relieve symptoms. So we understand there are two targets of psychiatric treatment, symptom relief and functionality. So clearly, medications are not going to be given for you to feel sleepy or lethargic during the day. If you do feel that way, you must speak to your doctor about it, and maybe the molecule does not suit you or the dosage does not suit you. We also need to understand that these medications are life saving. Somebody with depression or schizophrenia with hallucinations, unfortunately, if untreated, they can lead to further substance abuse and also, in some cases, suicides. So, when we are talking about life saving medications, let's not worry about that they are mind altering medications. In fact, it's entirely the opposite. Medications help me be more me. When I'm depressed, for example, I might look at my friends and think that they don't love me, or I might look at my loved ones and think that they are angry at me. So clearly, my judgment is impaired. When I take medications and I'm feeling better and I no longer have symptoms of depression, I can read these social cues better. So in fact, instead of making them in me into a different person, it allows me to be more me. There might be some side effects of certain medications. Every medication has side effects, but it again depends on your genetics whether you are going to be suffering from certain adverse effects of certain medications or not. A doctor, a psychiatrist is going to explain to you what are the possible side effects that you might expect. And even if something was not expected and it comes about, then that's precisely why you need to have regular follow-ups so that the doctor can keep an eye on them and inform you and then maybe if required change course of treatment. There are certain medications that might suit you the best, and there may be some mild side effects that you may be okay with. So there is nothing to be afraid of. If you have proper information and if you have access to proper information, then you will realize and you will see that psychiatric medications are in fact one of the safest medications that one can have. I know I have an advance directive. I have an advance directive that in case I get a psychiatric illness, what kind of medications I want and how long I want them for and which is going to be my doctor. I think that's a sensible plan to have. To figure out in future that just in case if you do need help, who should you take help from and what kind of help. It's always better to be informed so that you're less scared, you're less worried, and there's less stigma around it. Don't go to a psychiatrist or even a psychologist for that matter with a preconceived and limited version of what you think your illness is or what the treatment will require. Because in that way, you might actually be limiting yourself in terms of not only just getting better, but also evolving into a happier person. So be informed, ask your doctor all your questions. Your doctor is going to answer them as much as possible. Please don't rely on Google, WhatsApp, or Facebook University. Trust me, they did not go to medical college. Trust your doctor. Take a second opinion if you want to. But please take care of yourself. Make sensible, rational, scientific decisions for yourself. And please do not allow fear and ignorance and stigma to keep you away from a healthier and happier life.